What is the current status of the hospitals there and in the region?
Thank you. Good evening, everyone. Basically, the situation is very critical. It's very hard. It's still under control, but it's very hard. Why it's very hard? For many reasons. First of all, as you all know, Israeli army is continuing and attacking health facilities against all laws, against the Geneva law, and against all UN regulations, which we requested many times to stop without any response from anyone. So already we lost like 6 hospitals out of service, like around 7 to 8 hospitals working with the minimum capacity due to several reasons. Second main reason is a continuation and attacks on the healthcare worker and the EMS teams, on health facilities, on centers, which also making us struggling in transferring casualties between hospitals. And third one, don't forget, in Lebanon, we have around 1.2 million displaced people, which they have a lot of medical and health needs, which also is putting additional pressure on our system. And yesterday, as you know, one positive cholera cases was detected, and that's also additional pressure on our system. Our system is under pressure. We have a huge pressure from many sides for several reasons, but still things are under control.
So when we talk about the medical supplies and resources, what is the situation when it comes to hospitals in the south and also in the capital right now?
We are following up with these hospitals on daily basis. For sure, the need is big, and the access is very hard. That's why we are collaborating and coordinating all the time with ICRC, with the Lebanese Red Cross, and with all UN agency to take the necessary actions to deliver the necessary medical supplies for these hospitals. For sure, we have shortage because, as you all are aware, that our hospitals received around 10,000 casualties in less than 3 weeks, which is a very big number, especially that most of the cases needed to be admitted to the hospital, needed more than 4 to 5 surgeries. All these facts that I'm stating already will put an extra pressure on our system, on our health system. That's why, for sure, there is a shortage. We received many donations from several countries, from several friends, from several UN agencies. The need is still there. Also, don't forget the need for chronic and acute medication for the displaced people. Now we have a huge demand on chronic and acute medication on monthly basis. Our need is not 1,000 or 2,000, or monthly needs is more than like 200,000 to 300,000 box of medication, because we have around 25% of Lebanese people are now displaced.
Okay, when we talk about the ongoing airstrikes and the ongoing attacks in southern Lebanon and also in the capital, and there's been attacks, a series of attacks also in some cities in the north. When we talk about what's happening in the south, in the Kana included now, what kind of measures are being taken to ensure the safety of workers there? Because there have been concerns regarding healthcare workers in hospitals during these attacks and these escalations in the past few weeks.
I am very sad to say that there is no measures, because the Israeli army are not respecting any measures. They are not respecting any laws. They attacked UNIFIL, they attacked UN agency. They attacked Lebanese Red Cross. They tried to attack ICRC. They attacked EMS. They are not respecting anything. They attacked directly many hospitals. The measures is that the international community need to pressure on Israel to stop their attacks on health facilities, on civilians, on children, on women. That have to stop today before tomorrow.
Right, but I'm talking about the measures that you've been taking from the Lebanese Health Ministry
and
the department and the hospital department. What are you? How are you reviewing what's going on in the south specifically, and the necessary measures that could be taken in light of all the escalation that's been going on?
نحن the measures that we are taking, that we are evacuating injuries between hospitals. We are trying to decrease the pressure or to limit the pressure on the hospitals that are on borders or close to borders. So we are always 24 hours evacuating casualties and injuries from Bint Jbeil, from Nabatieh, from Tyr to Beirut, to Mount Lebanon, to Saida, at least to have to make to keep the balance in the health system. But again, even while evacuating or transferring casualties between hospitals, many times the AMS are being attacked, and that's also is a high risk for us.
Just one final word, Dr. Hisham, because it's very important for people to know that what are the hospitals or the regions and the areas that are right now running full capacity? And you said you had many of these hospitals under control.
Yes. Now, the hospitals are still working are in Beirut, a part of Mount Lebanon, North Akkar, and part of Shuf.
Oh, thank you very much. That
And
was
Saida.
Dr. Hisham.